Bedside manner plays a significant role in a patient's overall healthcare experience. Good bedside manner can lead to high satisfaction scores and a stronger patient-provider relationship, and it can also lower the likelihood of a malpractice claim. So, today we're going to give you 5 simple ways that you can strengthen your relationship with patients and improve your bedside manner. Welcome to Malpractice Insights, the show dedicated to helping healthcare professionals understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. My name is Jennifer Wiggins, CEO of Aegis Malpractice Solutions, and I'm so glad you've joined us today. If you're new to our channel, welcome. We're so glad you're here. We release a new episode every week, both on YouTube and your favorite podcast streaming platform, so be sure to like and subscribe to stay connected. Now, just a quick reminder before we jump in, we're here to provide general information on medical malpractice insurance and related topics, but not specific legal or insurance advice. So, if you have a question about your practice or individual coverage needs, be sure to ask your agent or legal advisor, or contact us at aegismalpractice.com. That's AEGIS malpractice.com. We'd be happy to help. So, with good bedside manner, healthcare providers can actually improve communication and reduce errors. How you interact with your patients through your tone, body language, and actions has a major effect on their overall experience and their understanding of their condition. So, here are 5 simple ways to improve your bedside manner. The first tip is a simple one, but it's important, and that's use their name. Using a patient's name shows that you see them as an individual and that you care enough to know who they are. It encourages them to be a part of the conversation about their health, and it helps to build rapport. And if you don't know how to pronounce their name, just ask them. Showing your humanness will actually make you more relatable and more likable. The second tip is to introduce yourself and explain your role. When meeting a patient for the first time, be sure to tell them who you are and explain your role in their care. Take the time to show how you'll be working within their healthcare team so they can know what to expect during the course of their treatment. If you're a specialist who is brought in for a consult, it's important that this is expressed to the patient so that they don't feel abandoned or insignificant if you don't visit them again. Our third tip is sit down and be very cognizant of your body language. Sitting down next to a patient actually builds connection. Instead of towering over them, it actually demonstrates that you're working with them, and it helps them feel more valued and appreciated. Avoid defensive poses such as crossing your arms or giving the impression that you're being rushed, like checking your watch or checking your phone or your pager frequently. If you're relaxed and confident in your body language, it will make the patient more relaxed and confident when they're talking to you. Our fourth tip is to show empathy and just listen. Taking a few extra minutes to get to know your patient helps form a better patient-provider bond. Listen for cues about their life and then comment on them. For example, if your patient mentions plans for an upcoming vacation, say something like, "Tell me about your trip. That must be so exciting." It seems simple, but it's really impactful, and it's another way to show your patients that you really care. When patients trust their providers and they feel like they are heard, they're more willing to openly discuss an issue, and they tend to be happier and more understood and less likely to sue. And our last tip to help you improve your bedside manner is to offer reassurance. Put yourself in your patient's shoes. What might be a routine diagnosis for you could be a life-changing event for them. Sometimes healthcare providers can forget what it's like to be on the opposite side of the provider-patient relationship. So, pause, be empathetic, and try to see things from their perspective. Be patient and observe their reaction, and then be available to answer questions ongoingly. If a patient mentions being worried about a procedure, use statements such as, "I understand this must be scary for you," and then offer reassurance and partnership statements such as, "I understand this is happening to you, but we're going to get through it together," or "I will be with you every step of the way." Part of the value that you get from your malpractice insurance carrier is not only the coverage itself, which is obviously important, but they also have risk management and educational resources that will come free with your policy. Your malpractice carrier wants you to be equipped and able to handle difficult situations, so they're going to provide you with courses, white papers, and seminars on a variety of risk management topics, just like this one, to help you reduce your risk and be a safer provider. So talk to your agent to find out what other topics and risk management tools you can take advantage of today. And if you have any questions on this topic, or you want to make sure that you're covered appropriately, click the link in the description box below where you can connect with us via phone, email, or chat today. And if you're listening, please visit us online at aegismalpractice.com. That's AEGIS malpractice.com. We have some great episodes lined up for you guys in the next few weeks. I hope you found this one helpful, even though it was probably one of our shortest ones. If you could do me a favor, can you just leave us a like and a review? And please be sure to subscribe to our show so that you can catch our next installment of Malpractice Insights, where we're dedicated to helping you understand medical malpractice insurance and providing you with the solutions you need so that you can get back to the work of practicing good medicine. This is Jennifer Wiggins. Thanks for joining us.